AM 1220, KHTS, HometownStation.com. I am T, here with an hour of Dr. Proctor, where we have an opportunity to peek over the doctor's shoulders and find out exactly what it is they are doing. As Americans are aging, taking care of parents, there are a lot of questions anymore about healthcare and what is happening, and there are a lot of answers to how to reach your optimum health, and when you're not feeling well, how to take care of that. And my goal is to bring in a doctor every week to talk about various things that affect all of us. And if we can, either demystify it, break it down a little bit so it's a little more understandable and certainly not scary. In the studio with me today, I have Vicki Longquich, who I've known for a very long time. She's been one of the people who's taken care of my family's good health and the health that I am trying to attain. So, Vicki, thank you for being here today.
Thank you very much, T. It's nice to see you.
I am very grateful to have you in, and if for my friend who's listening and doesn't know everything about you as I do, give me a little bit about who you are, what you do, and we'll take it from there.
Okay, well, first off, I'm not a doctor. I'm Vicki Cranford Longquich. I'm a physician assistant, and I've been a PA for 28 years. Physician assistants are mid-level providers, and as our community ages, as our population increases, as more people have access to healthcare through different changing laws, we need people to treat. We need people to evaluate.
Absolutely. And I think sometimes we get hung up on the word doctor because there are plenty of medical professionals who can help us, take care of us, look after us, and deal with situations. It doesn't always have to be, but we get hung up on the word doctor. And the show, even though we call it Dr. Proctor, it really is all about medical professionals and taking care of our optimum health, or again, getting to it. And again, you have been the person who has taken care of my well-being and my physical, and honestly, truly, you're one of those people, I come to you just for the hugs, so there's a spiritual aspect to it also, but you take care of everything that I could possibly need when I walk through the door of my doctor's office.
You know, I'm very fortunate to be able to have practiced in family practice for most of that time. And so I do have a little bit of knowledge about everything. Physician assistants are in every part of medicine. We are in every specialty and subspecialty. I have friends who are cardiovascular and thoracic surgery PAs and are cutting chest. So I like that we're accessible. Physician assistants originally started out with returning corpsmen from Vietnam. And so there were these medical people with incredible training and no way to use them in the private sector. And that's how PAs were born 40 plus years ago.
So you've been around for a while, and I am hoping and encouraging anyone who is needing to go to the doctor's office, to their physician, and know that the minute they walk through that door, seeing a PA is just as good, if not better sometimes, because your level of care, I have to say, in my own family, has been Excalibur. You take the time, you listen, you look us in the eye, and you are approachable, you're accessible, and across the country, more and more PAs are taking on some of the roles that perhaps a doctor might have once upon a time, certainly maybe more than 40 years ago, when A, there weren't as many people,
yes,
and B, there weren't enough doctors to perhaps go around.
And as we have an aging population, we're catching things even with our young people at earlier ages. Let's have the PAs and the mid-levels do 80 to 90% of it, so that those things that only a physician can do, we save them for those.
That is perfect.
And I think, life is a village. And I don't think healthcare should be isolated either. The team approach to healthcare is one that is growing and that we see great growth in. And it's one I'm very comfortable with.
Well, I, for one, am very grateful for you and your peers. One of the things I wanted to talk about today, one of the perfect examples of when you feel you need to seek out medical care, the flu season It's coming, isn't it, Vicki?
It is. It is. Flu season, as far as the surveillance that we can receive from the CDC, starts officially October 15th. We start receiving surveillance reports. If you're tucked into the CDC is the Center for Disease Control. They are a wonderful clearinghouse for information on infections and epidemiologic studies and what's going on in our country and the world. So I often check the CDC website, and they have a website for health professionals, and they have a website for the general public. Wonderful source of information. We have already seen both type A and type B flu in our office. I work in a freestanding urgent care family practice that's been around for 20 years over on Lyons Avenue, and it is just a great facility because you can walk in because you can't always schedule when you're sick.
Well, and the flu ain't got time for a calendar, does it?
No, it doesn't.
It doesn't know October 15th from November 15th. It shows up when it shows up. And I'm going to throw myself under the bus. I've never had a flu shot.
Ooh, we're going to get you this year.
I fully plan on getting my flu shot, but I would like to demystify a little bit about the flu, partly because I too, like my friends, have thought, do I need a flu shot? And I did a little research, and this is why you're here today, because we're going to break down what exactly it is. First of all, the flu, or when it goes by its name with its parents, it's influenza.
Yes.
When its family is speaking to it. The flu is a viral infection. It affects the respiratory system, which is your nose, your throat, your lungs, and it's not the same as a stomach flu virus, which affects other areas south of the border. But this respiratory virus that we get, one of the things I'm always constantly amazed whenever I research something and I go to look at who's risk. I love what the flu is also, not only does it not care about the calendar, it does not care who you are. Who is at risk for the flu? Everybody.
Everybody.
Doesn't matter. So, and for most people, flu is it's debilitating, problematic, and with complications. The flu can be deadly.
Yes.
Lest we forget, 1918, that was
the whole flu endemic that wiped out
and
a
huge portion of the population. So who's at highest risk for this is young children under 5, especially under the age of 2, senior citizens, 65 and older. And again, I think that's a relative term. We like to say senior citizen is 65, but I don't think it knows or cares about the calendar either, or your birthdays. Pregnant women, people with weakened immune systems, people with chronic illnesses, such as asthma, diabetes, heart disease, kidney disease, people who have who are obese, and residents in care facilities. Those are the people at highest risk. But here's where it gets tricky. When we can know who's at risk, we know we are all at risk, and the flu is often mistaken for the plain old common cold. And I'm going to have you, Vicki, walk me through the difference between the flu and a cold.
Okay. Both are viral illnesses, and so they pretty much attack it the same way. When you have a virus, you'll have runny nose, a little more mucus, mild fever with the cold. With the flu, you're going to have a much higher fever. You're going to have more body aches. You're going to feel miserable.
So the fever, first of all, is really anything over 99, 100?
99, 100. About 100, yeah.
So if you're home and you're not feeling well, because I'm going to throw myself under the bus. I'm a pansy. I'm a complete and total pansy when it comes to being sick. And you can attest to that. You can throw me, you can kick me too. When I don't feel good, it is the worst thing that's ever happened. And I think, a lot of people are that way. So a fever, when we take the thermometer out, the common cold might be 100, 101. What are we talking about higher with the flu?
Up to 100, I would say, is a cold. 99 to 100 is up to a cold.
Beyond that?
Beyond that, we might be talking flu.
Okay,
And
so that should be our first go-to, that we might have the flu.
So get a thermometer.
Get a thermometer.
Most people don't have them anymore.
And you know what? You no longer have to stick that glass tube in and wait 2 minutes. And, now it's a simple little device that's on your forehead. All right, so number one, the first thing that indicates we might have the flu is that higher temperature. And then where sore throat, sneezing, and runny nose is a cold, it happens kind of slowly, doesn't it?
Yeah, but a flu hits you like a ton of bricks.
Like right
It
away.
hits you like you could be 3 hours earlier, and then all of a sudden you start crashing. We say that I make a notation, positive blanket sign when people come in. When people come in, especially teenagers with the flu, they come in wrapped in their favorite blanket because they just feel miserable and they need that comfort. Plus, they're chilled. You get fevers, chills. With children, you may have more GI symptoms associated with the influenza.
So the gastro system starts to go.
Kids do a total body reaction, so they get a little more. So they may have some diarrhea. But the biggest thing is just you have the chest ache, you have the coughing, you have this cough that just won't stop, and you feel miserable.
You just feel achy and...
like somebody pulled you through a knothole.
Oh, well, okay. That's not, we don't like that feeling.
No,
we don't care for that. All right. So the difference between the two. Now, when we go into the doctor there, or the doctor's office and we go to see our physician or our medical staff, there's no test for the cold.
There's really not any test, and there's no treatment other than symptomatic treatment. But we do have some fairly accurate influenza tests right now.
Okay, and these would be the rapid diagnostic testing for influenza, and it's pretty swift, right? Once you walk in?
About 15 minutes for the test to run. So, and it's a nasal swab. So they swab,
cotton ball or cotton Q-tip.
Little foam Q-tip up your nose, yeah.
All right. Not pleasant, but it has to be done.
And it's quick.
Okay.
And once it's done, we start the test running. And the testing tests for type A and type B because there are multiple strains of influenza.
Oh, that's the other thing. It's tricky.
Yeah, they're not necessarily treated differently, but just knowing which type gives a little bit of idea as far as communicability.
Now, this is where the poor doctors get hung up and the scientists, because the flu not only does it not care about the calendar, it's a tricky little minx because it is always mutating.
Yes.
Right?
Always mutating.
Which is why when we talk about the vaccine, that, okay, not totally sure, we're doing the best we can. We sort of know what the flu looks like. We kind of know where it lives, and we're going to do the best we can to identify it and present that vaccine. But she just might, like Mother Nature, mix it up on you.
Last year, we didn't have a great response to the flu vaccine. We had between 60 and 70% failure.
Okay, but when you go to Vegas and you put $1 on the table and you
play much worse odds. Exactly.
Right. So I often wonder why we get so wrapped up in the idea that, it might not work. Because I have to tell you, I've been that person. Why should I get a flu shot? It might not work. Oh,
but it might work.
You know what? And it's worth it.
It is worth it. It is worth it. And that's what we're seeing.
It's not a car payment.
They are looking closer at strains. We've got some that are following through. This year, we're offering the quadvalent, so we're offering coverage for 4 strains. And the scientists who follow the epidemiologic patterns, because flu doesn't start in the U.S., it starts other parts of the world and everything, they're trying to follow the patterns that are the most.
Everyone's trying to work together.
Yes, exactly. It's a village.
Now, thank goodness we don't have to wear the clothes like the people.
Yes.
If the rapid test can give an answer while you're in the office, 15 minutes, cotton swab up the nose, you do the business. How long after you've contracted the flu is that test valuable, or is it pretty much right after you've got it, if you think you have it?
You want to come in within the first 2 days.
Okay. Would the test know in the first 24 hours?
24 to 48 hours.
Because I know people who go in and say, they tested me, but, I hadn't had it long enough. So that's not the truth, right?
Well, it may not have created enough of the antibodies for us to come up with, but we can also use our clinical judgment, because for years we didn't have testing.
That's right.
And clinical judgment, and we will actually say, although the test is negative, this clinically presents as flu, and I'm going to treat it as that.
You have the symptoms, you have all the hallmarks,
If it looks like a duck, quacks like a duck, let's go with the duck.
You have to believe that it is a duck. Okay, so, all right, we're not feeling good, or we have someone who doesn't feel good, and one of the best things we can do is bring them in, have them tested. Now, the complications, before we go to break, again, we're talking with Vicki Longquich, who's a PA, who's talking with me about flu today. And in addition to just the fact that it makes you feel miserable, what are the complications that come with this is the reason why we're going to talk in a little bit about prevention and treatment and vaccine, but a little bit about complications. The flu can be wicked.
The flu can be wicked. One of the biggest complications is pneumonia. And if you get pneumonia with the flu, it's a virus. There's not a lot of really good treatment options. If you come in early, we can treat you with some medication. There's a couple types out there. But once you get pneumonia, these are often the people that have the fatalities.
Right.
And this may be even with our young adults.
Yes.
If you get pneumonia, and that's a tragic thing.
And we want to prevent that. First,
absolutely. So that's why you come in early, get checked. We, when you see a baby that's very ill, they may need more supportive measures. They may need to be hospitalized. They may need round-the-clock oxygen. They may need breathing treatments and things like that. With an adult, if we can catch it early, we can avoid a lot of that. Babies have this, like I said, total body response, so they get really sick really quick.
They get really sick.
The young ones. And so, but someone who's diabetic and sugar will go way up, so there's a lot of complications that come from just having an infection.
Right.
So their sugars go up, and now things aren't well controlled.
Now their
so
system's out of whack.
Now their kidneys aren't working well. There's a lot of complications that can happen.
So in addition to pneumonia, dehydration, and then serious infections of sinus and ears, and this is something we want to avoid at all costs, especially for young kids.
Exactly.
Having those serious infections can affect their hearing. It's
long term. You can have a serious infection that penetrates to areas you don't want it to be, that will now cause lifelong ramifications.
And all of this can be avoided. All of this, for the most part,
prevented or minimized. Because even if you get your flu shot and you still get the flu, the symptoms are often less than if you had not got your flu shot.
And that's sort of what we're looking for.
Yeah.
And again, when we talk about the flu and we talk about who's at risk, as I've said before, I love the idea that flu just don't care. I don't know if you've ever seen the clip for honey badger. Honey badger don't care.
Yeah.
The flu is honey badger.
Yeah.
It doesn't care who you are. It doesn't really care about flu season. It sort of, thumbs its nose at us. Everyone is at risk for the flu, but the idea, for the most part, you can prevent it, and then talking about how to treat it. And again, you have to remember the flu and the common cold are two different animals.
They are.
And you can take care of the cold yourself.
Right.
You don't have to go to the doctor's office. In fact, you probably shouldn't.
Right.
Because you're just going to infect other people who are there for other reasons. And if you do get just the common cold, and again, it mimics, it's got the nose, the throat, and the lungs and everything involved, but it doesn't have the high fever. It doesn't have the increased or the weakness and just the feeling that you've been hit by a train. So you can stay at home and you can treat that with fluids and rest. But when it comes to the flu, it's also very similar. And when we come back, we will talk about the flu a little bit more. We'll cover, again, who's at risk, what the symptoms are like. But then we'll also talk about treatment and how the best way you can take care of that, but even more importantly, we're going to get into the prevention of the flu. So many hospitals right now are impacted by people who during flu season. I had spoken with one of the hospitals here. They had 80,000 people a year ever since things started to change where people could get health care. Now they're impacted by 3 times that number. And heaven help us when flu season is upon us, because people start to show up in droves at the hospital. So again, if we could prevent and do some things to kind of protect ourselves and our loved ones from ever having to see the flu, ever having to see the inside of a hospital, we would definitely like to do that. Vicki, when in your office, do you see a tremendous influx of people, more so than...
Our numbers go up by about 20 to 30%.
Oh, and then it makes it difficult to take care of everyone with other issues.
Exactly, and we try too. It's like if I have patients coming in for well care, I say, come in March.
Come in after flu season.
Yeah, exactly.
And you don't want to be subjected to it, because those people are contagious in that waiting room. And we're going to talk about how you can protect yourself against that too. Again, we're here with Vicki Longquist. This is Dr. Proctor on your hometown station, AM 1220 KHTS.